It's great to welcome to the program today Dr. Marty Makary, who's a Johns Hopkins surgeon and a New York Times bestselling author. His book, The Price We Pay, What Broke American Healthcare and How to Fix It, is available now on Amazon. I think a good place to start is what did break American healthcare? I mean, former Cigna executive Wendell Potter writes in his very good book, Deadly Spin, about how in the period between World War I and World War II, the U.S. was sort of headed in the direction of a system more like many of the European systems. But at the time, it seemed too German when we were not getting along well with Germany. That plan was abandoned, and that was sort of the beginning of the plan and the system that we have now. How do you see the crux of how we got to where we are now?
Well, people have a lot of opinions, David, on healthcare, and everybody has their own experience or their interface, even doctors. We tend to see it from our vantage point in our specialty. But if we look broadly at the entire system, and we actually are not beholden to any particular special interest or stakeholder and can talk openly and honestly with a critical view of the entire system, it's really two fundamental root problems. Number one, pricing failures, and number two, inappropriate care or the appropriateness of care. If we look at the loss of competition in healthcare and how you can't get a price for basic services, people have a right to be angry. And when those services 20% of the time are unnecessary, which is what our research from Johns Hopkins has shown in a national survey of US doctors, they say 21% on average of all medical care is unnecessary, testing, even procedures, medications. These are the two fundamental areas that we can improve. And in the book, The Price We Pay, I tried to find the disruptors nationally who are actually fixing healthcare by addressing these two underlying root problems.
Now, there are different philosophies that would have one person hear what you just laid out and go in the direction of, well, the solution would be total free market, for profit, let everybody shop and do exactly whatever it is they want, let the sort of laissez-faire approach fix the problem. And there are others who would hear what you said and say, oh, no, we need a completely different system. We need one actually where we can have bigger parties negotiating on our behalf, up to and including the government through some kind of single payer system. Which does one or the other strike you as the best path forward to solve the two problems you outline?
Well, to be very honest, David, I actually think that there's tremendous consensus in the United States, if we can lay out the issues for what they really are, that price gouging is wrong, and that price gouging happens today, and it will continue to happen if the government is the payer. And by the way, the government does not have a great track record as being a very good negotiator. When you deliver a baby in Boston, you can have that done for $6,000 or $41,000, both at Harvard hospitals. There's no difference in quality. These are sometimes the same doctors. Price gouging has sadly become a way of doing business. And if we can get rid of the waste in the system, that entire spend that makes a lot of people rich in healthcare, but is wasted money, we could create efficient marketplaces and actually cut the waste in a way that's bipartisan and it retains the private health insurance system and at the same time keeps the healthy Medicare government payer system going strong.
So it sounds like you're saying you wouldn't necessarily want to expand any government involvement. You would want to keep Medicare and maybe Medicaid, but you would want to improve the for-profit healthcare system that we have. Is that what I'm hearing?
Well, I applaud people who find Medicare for All attractive because they want to get rid of the waste. The problem is down the stream, long term, 100% of the time in every country around the world, including our own, long term governments tighten the belt on healthcare expenditures, and you can be left with a dilapidated system at 10 or 20 years. If we want to cut the waste, which is where I think there's broad consensus, we can do that by creating transparency within the system. I opened the book, The Price We Pay, with a group of doctors in the Washington, D.C. area that are gouging Medicare, that are taking advantage of the system, that our taxpayers are funding a group of doctors doing unnecessary procedures all day long. That will continue with Medicare for All. That doesn't stop. So if we just look at competition and transparency, we can actually reduce the waste because I personally believe, David, that we already spend enough money in America to give everybody gold-plated health care. We
Oh,
just
yeah.
have to cut
There's
the
no question
waste.
that we do. I guess I'm not sure that I agree with you because, yeah, okay, so I think if you say to basically any American, do you want to get rid of waste in the healthcare system? Basically, every American would say, yes, I do want to get rid of waste. The problem is that many Americans see profit in an area where there is completely inelastic demand as part of the waste that should be removed. There are people who see a system that requires medical billing experts on both the insurance side and the provider side as a form of waste which we could get rid of through some kind of government-centered program. So I do agree with you that waste is bad and Americans want to get rid of it. I don't think that there is as much agreement as maybe you're suggesting as to what constitutes that waste, though.
Well, if we can agree that there's a tremendous amount of waste, if we can agree that walking into a New York hospital and having a bill of $70,000 is egregious when the market price is 6 to 7.
Sure.
There's a tremendous amount of waste there that can be cut without all of the infighting that's partisan about what's the great philosophy to dominate healthcare. This is the low-hanging fruit in the system. And trust me, nobody has been more aggressive in fighting the profiteering philosophy in medicine that has taken over and ruined the medical profession in certain pockets of America than me and my team. We go to hospitals, we call out CEOs. We just did a giant expose of hospitals that sue patients in the state of Virginia. A study that came out this week in JAMA showed that some hospitals, about 10%, aggressively take their patients to court when they can't afford their bill. We have called them out, and the hospital that was the worst offender announced they are going to stop suing patients as a result of our work in the NPR piece that ensued. So we have been calling out people that have been using profit to take advantage of people all across the country, and you're absolutely right. It's wrong. It erodes the great public trust of our medical profession, right? Hospitals were built to be a safe haven, a refuge for the sick and injured, regardless of their race, creed, or ability to pay. That is the charter of most U.S. hospitals, many of which were built on charity or built by churches or by land grants from the community.
Yeah, so let's focus in
now?
on that a little bit because that may be something my audience doesn't know about. I think my audience probably understands the philosophical differences sort of underlying the idea of these systems that we're talking about. Talk a little bit about the fact that there are lawsuits against patients by hospitals. Talk about the wage garnishment also that I think many in my audience have no idea is even a thing, that hospitals do have mechanisms for actually garnishing the wages of former patients for unpaid medical bills.
Sure. Well, my research team started looking at the markup on medical bills, identifying extreme outlier facilities, hospitals, even physicians who are charging 23 times more than what the Medicare allowable amount is. When we would approach hospital CEOs around the country and ask them, why are you charging 5 times more than the next hospital that sees the same case mix and payer mix? The answer was always, well, we have secretly negotiated contracts with insurance. Don't worry, Marty, nobody pays those bills. So we did some research and found out, no, a lot of people are expected to pay that bill in full, and those people are expected to pay that bill, and if they don't, they're taken to court and sued by a hospital and have their paycheck garnished or liens put on their homes. And we found one hospital that has sued 24,000 people in a town that by census data has 28,000 people living in it. We went to New Mexico, and in the book, The Price We Pay, I visited some of these courthouses where we found the courthouse transformed into a taxpayer-funded collections agency for the hospital. Lives ruined. I mean, these are hardworking Americans who've been financially devastated, right? Most people don't live like you and I, David, right? We are relatively wealthy in the United States, right? God's been good to me. I have a good life as a surgeon at Johns Hopkins. Most of America has less than $500 of cash in savings. They live a very different life, and healthcare has forgotten them. And we refer to them as if they've done something wrong, like they've been irresponsible and failed to get health insurance. No, these people have health insurance. Our research shows that they're insured, they're working. The most common place they work is Walmart. Number two is U.S. postal workers, workers at Lowe's, nurses and housekeepers at hospitals being sued by their own facility. We did the expose on Mary Washington Hospital. We're now looking at UVA, which gets taxpayer funding and sues a lot of people. Memphis, the Baptist system just highlighted in ProPublica in New Mexico. So we're finding hospitals around the country that are violating the public trust of our great medical profession. We're calling them out. We're doing this at restoringmedicine.org. And so far, the first hospital that we talked to has announced they are going to stop suing patients.
Would someone have recourse to say that they were sort of in a situation of duress when they were in the situation where they sort of agreed to receive certain treatment? Because in certain emergency situations or even urgent situations, you're not exactly sort of calmly stepping back the way you would if you're thinking about choices for buying a car and making a decision. You're in a situation where a doctor says this is the procedure you need. Then later you end up getting sued for something which I would argue there is a sort of analogous duress type of situation. Is that recourse that these lawsuit victims can sort of try to employ?
Yes, but David, to be honest, they're too scared. They are served at home by a sheriff's deputy that wakes them up at 7 in the morning, we found in some cases, and they're told to come to court, and they come to court and are asked a question, do you owe this money? They're afraid of perjuring themselves. They don't really understand what's happening. They just say yes, and then they have to provide their routing number and account number in the back of the courthouse to the hospital, who pulls the money out of their savings, or their paycheck is garnished, or a lien is put on their home. We have been representing patients pro bono as best we can. I will list my name as the medical expert on their case for free. And I will argue to the judge, the patient doesn't owe the money. I can't mow your lawn and charge you $50,000 without a contract. There's got to be an agreement. Many people are asking, I want to know the price of what it's going to cost to deliver a baby beforehand. 60% of medical care is shoppable. That is, it's elective, right? No one's suggesting we give you a price if you get shot and need to have a heart valve replaced in the trauma bay. Okay, we're talking about elective care. Hospitals can get their act together, physician groups, healthcare, the elite, the medical establishment, and figure out a way to do honest and fair, transparent billing to patients and give them a price before the service. Many of these patients sued, asked for a price, and were told the runaround, the typical runaround that's common in hospitals. If you are somebody paying out of pocket or out of network, which is a fast-growing group of Americans, and you need to deliver a baby, don't you think you should be able to look up what it costs at different hospitals, assuming it's an uncomplicated delivery? So we've argued to the judges, there is no valid contract. People come to us in a hospital under duress. They are stressed, they're scared, right? When I see a patient in the emergency room or in my clinic who was told they have cancer, there is one emotion that dominates their mind, and that is they're petrified, they're scared. We have historically been a refuge for people when they are hurting. Now we've got patients in the community saying, in Virginia, one woman said, I'm at home and sick and scared to go to the hospital. They've sued me twice. That is violating this great public trust that we've had. And I think doctors and nurses and everyone at a hospital are starting to speak up. And we're seeing this now with our Restoring Medicine Facebook page and other venues.
The book is called The Price We Pay, What Broke American Healthcare and How to Fix It. It's available now on Amazon. And we've been speaking with the book's author, Dr. Marty Makary. Thanks so much for talking to us about this today.
Great to be with you, David.